Hi everybody, again Jay Mehta here. This is the video dedicated to intravenous immunoglobulins or IVIG, which is basically a broad immunomodulator like thymosin alpha, and it is multi-targeted therapy. Basically, IVIG is simply IG immunoglobulin G, which has been obtained from a lot of donors and then reconstituted, packed, and presented to the patient, right? It is a broad spectrum immunomodulator. So that means just remember one thing, it is the best sort of immunomodulation which is available to address multiple immune pathways. Okay. We discussed intralipids, we have discussed tacrolimus, thymosin, all of them follow singular pathways. This guy, IVIG, is basically broad spectrum. It has all the pathways which it covers because of the complement protection, that is complement inhibition, anti-idiotypic antibodies, T regulatory cell expression. It increases T helper cells too. Okay, and it also makes sure that the patient develops HLA tolerance in the body. So that means it is an extremely broad spectrum, broad acting immunomodulator which you can give to a particular patient, especially to a patient who has encountered recurrent implantation failures. Right? Now remember one thing. In idiopathic autoimmune recurrent pregnancy loss, this is where you have the strongest evidence to use IVIG for that particular patient. Basically, in situations where you are not exactly sure. Okay, that is one. In second, where there is autoimmune recurrent pregnancy losses, that means autoimmune of any types, which has been resistance, like anti-TPO is present. Let's assume there is ANA titer positive, Sjogren's syndrome, rheumatoid arthritis, wherever. After your baseline therapy has not worked in the previous cycles, then in those situations, you can make sure that IVIG is used. It can also be used as an adjunct when previous therapies have failed because it is very broad spectrum. So it is acting very broadly. Let's assume one patient you gave intralipid in one cycle, it did not work. Next cycle, you can give intralipid plus IVIG. Let's assume in one cycle you did PLIT, it did not work. You can give PLIT plus IVIG. Especially in situations when there's a lot of C1, C1 and C2, C2 match and mismatch, you can easily give IVIGs to those patients. But the only problem of giving excessive IVIG is that this is pretty expensive. Okay. This is not a very cheap available therapy. Of course, what we do is we call our physician to make sure that the dosage is calculated nicely. The basic dosage is 400 mg per kilogram, which is to be administered IV, and it is to be given at least 2 to 3 cycles prior to conception. If in case you are doing an embryo transfer, then you have to give it at least 1 week, just like intralipids, 1 week, and it has to be given prior to the embryo transfer. Okay, it is otherwise a very standard infusion, but what we normally do is, as I have mentioned, we give the patient antihistamines. That means Penalcan is given to quite a lot of these patients. We give the patient a low dose of steroid, that is hydrocortisone, and we also give the patients paracetamol along with this supplementation. It is just a protocol which we follow, which I have enlisted here, which our physician has asked us to follow. All right, so just keep that in mind. Coming to the evidence and coming to the usage of this drug, because remember it is expensive. Okay, so the best evidence is available where previous therapies have failed. That is your best evidence for using IVIG. Correct? You cannot use IVIG as a primary line therapy because whatever data we have currently, which is available even from meta-analysis, no, it is not of a very large sampling size. The difference as far as the pregnancy rates are concerned are also not absolutely massive. Okay, but as I've mentioned before, out of all the therapies which are available for a particular patient, you cannot say and think that IVIG offers a better outcome. IVIG only to be used in refractory cases and with a very strong financial counseling, because this can really drain the patient lot of resources.